break, and that way we can break a little bit. Yes, and that way that's inside the program. Yeah. Okay, that's even better. That way we can break things up a little bit. Okay. Okay. Let's have a final minute, and then we can begin. You can see me, right? Yes, yes, yes. We can all see him. Yes.
Le slide no, ma a lei sì. Le slide non le vedete? No.
Don't see the slides? Let me see here. I can see him, but not the slides. Yeah, I don't see the slides.
Adesso le vedete?
Can you see them now?
Non ancora.
Not yet.
Il suo schermo, vediamo.
We can see, okay, we can see your screen, but not slides. In other words, your computer screen, but without the slides. Can you see a slide yet? No, not yet. Nope. Nope.
Allora, vediamo perché non si riescono a vedere. Adesso sì.
Can you see them now?
No.
No, not yet.
Adesso sì, le vedete? Adesso.
Yes, 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 yes.
Professore Maurizio
Yes.
è il suo nome, no?
Maurizio is your family name, your surname, right? Maurizio is your surname. We can begin now. It's 3:35, 36, 35. Yesterday we defined psychology as a science, which uses its science as its modality of cognitive knowledge and has its own experimental empirical method, which is typical.
Per analizzare, quindi frammentare.
Psychology is that a scientific discipline that uses the methods that are typical of the empirical experimental sciences of the philosophical rational sciences. It analyzes, describes, explains, and foresees human behavior and in its cognitive and emotional components. And physiological. Now, then we saw that there exist various types of psychology based on the criteria that we use. It can be subdivided in various types in relation to its to the criteria that it's used. We can have the nosological and epistemological criterion, or the criterion of finality and the criteria of the model of research and the criteria of the theoretical model. These are different types of psychology. Some mention that certain aspects can be expressed in a very strong deterministic way. In fact, we'll see today that with certain models, there are certain models that are strongly deterministic. I did not show. I showed you 4 or 5 that are the most representative, but little by little, as we see them, see their characteristics. Some, in fact, to emphasize the rigid. We'll see which aspects are more emphasized, depending. Now, okay, the theoretic model is very important from the hermeneutic point of view, and it furnishes the key of reading of all of the psychological world. It furnishes anthropological contents, it furnishes methods, and therefore also gives a direction to any type of analysis or eventual intervention that we may have, whether it's religious or psychological. Okay. Now we said that in all the world there exist 500 models of psychotherapy, but the most widely used are about 10 in all the world. 80% of therapies in the world use the cognitive method, the one that I was trained in. I've been trained in that one. I initially used the behavioral method, then cognitive method. Now I've moved to more an existential humanistic model. I'm using various aspects, and I'll explain later on why it's important to enlarge the horizon. Why did I use the cognitive method? For various reasons. The first reason was that it's very effective. It's widely effective. We yesterday saw the effectiveness and the pragmatic aspect. We spoke about psychotherapy. It's we have this habit to give the therapy to anything that you might experience as an a pleasurable aspect. That is that there are people who speak of mountain therapy or tree hugging therapy or naked therapy or okay. Let's say that the widespread the spreading of the cognitive method is due to the fact that it certainly is a model, an approach that functions, and it cuts out, but it cuts out certain very important aspects, and then it is one of the few models that reflect the scientific model, even if it pauses too much on the empirical experimental method. This is a limit, I would say, or of the characteristic in the world of psychology, precisely because the world of psychology is very it does not know philosophy at all. It doesn't realize that the possibility of being scientific without necessarily being empirical experimental. It doesn't recognize that. No. Now let's go more into the specifics now. What is it when we enter into the practice of psychiatry and psychotherapy? Naturally, we speak of okay, it's very important here to understand what we're talking about. Okay. I'm going to give you a definition that you often hear that I use that has a fundamentally phenomenological approach, which tends to recognize phenomena as they are, also because it is an objective definition, which we often see in the field of psychology and psychotherapy. It's difficult to give. There's someone who speaks of mental illness when they, and by illnesses, mental illnesses, they are thinking of psychosis and psychosis, but the term mental illness is a very generic term. The manuals express themselves by saying that mental illness is a it is a modality of being. This is true. Some think of it in this way. The problem is that evidently it's a modality of being that has certain characteristics.
Chi è, diciamo, ha questa diagnosi di malattia mentale debba rivolgersi a qualcuno che ha il ruolo di aiutarli. Quindi parliamo di psichiatri e psicoterapeuti. Quindi adesso è corretto ovviamente utilizzare una diversa definizione, però poi da questa definizione deve avere anche delle implicazioni pratiche, visto che noi poi siamo soprattutto operatori, operiamo, no? Siamo fisioterapeuti, educatori, pastori, quindi operiamo sulla realtà umana. Quindi altrimenti si tende a giocare con le parole, no? Cioè, modalità dell'essere sicuramente, certo, una possibile definizione anche affascinante, ovviamente, Però poi non si capisce,
Okay.
però a
We
questo
don't
punto
understand at this point.
una persona che è il cosiddetto malato dovrebbe rivolgersi a un'altra persona che è il cosiddetto curatore, che è il cosiddetto psichiatra o psicoterapeuta che sia. Quindi insomma io sono molto d'accordo
Okay, I agree with the use of a wider language outside of psychology, which includes philosophy, philosophical language. Those who speak of a definition like these as a modality of being, obviously it goes back to they they are going back to the knowledge of ontology and being as being, and the philosophy of being. But the important thing here is the implementation and the possibility to express oneself in existential interventions, and the certain points or importance of reflection can be interesting here. It's clear that we need to treat the other as a person and to accept them in his conditions. And certainly there are certain aspects, evident aspects that need to be reviewed, and they go out of their role. We need to understand if there's something that is wrong with him. And in this definition, we try to make this type of work. We try to offer a definition that is as usable as much as possible. Now I'm going to read these and then I'll come on to the, okay, a mental illness involves the person and expresses in with various, with different, okay.
Intanto che cosa si intende per disturbo? Per disturbo si intende qualcosa che è al di fuori di un
When we talk about disorder, we're talking about something that's outside of
dovrebbe esprimere un equilibrio. Appunto, se noi vediamo delle persone che abbracciano degli alberi, il dubbio che ci sia un disturbo ci viene. Poi magari è una tecnica che viene utilizzata, poi magari è soltanto un ruolo all'interno di una finzione che potrebbe essere una finzione teatrale, cioè, però il dubbio ci viene che c'è qualcosa, se noi incontriamo una persona per strada che gira in mutande, pensiamo che ci sia qualcosa che non va in questa persona. Se lui gira in costume, diciamo, sulla spiaggia, siccome quell'abbigliamento è più contestuale, pensiamo che di fatto non ci sia un disturbo, ma se lui lo fa al centro di Roma, c'è qualcosa che evidentemente può far emergere l'idea che ci sia un disturbo. Qua parlo di disturbo che coinvolge...
Right now I'm talking about a disorder and how you define the expression disorder in psychology. This is what he's speaking about now. As workers, as healthcare workers, we try to identify the problem, but we are necessarily oriented to the person. Some psychotherapies do like the cognitive and behavioral type. They sacrifice the idea of person because they concentrate only on the problem, not on the person. And so they make the error that the psychiatrist does when he just prescribes drugs. He does a great work in the sense that he does great work of studies of, in an abstract sense, a biochemical study, but he doesn't pay attention to the person. This is the problem that psychiatrists fall into when they limit their practice of psychiatry to mere prescription of drugs. We need to work on problems, certainly, but we also need to be oriented to the person. And sometimes some practices of psychotherapies, in order to be scientific, they sacrifice the most important aspect, which is the focus on the person. It's like when I realized that by studying mental processes in the lab, when I was very, very young, and I was an experimental psychologist, and I did it for 3 years after my degree. I realized that the important aspects were outside of the lab. The person was not the sum of the unity of the parts, but it was more than the sum of the properties of its parts. So I left the lab, and I encountered people in reality. Now, other approaches, some certain person in their practice have lost the some people slide into a form, an excessively pragmatic form and practical form of practice. This explains why some psychiatrists and some psychotherapists sometimes use methods that are frankly bizarre, like tree hugging therapy or mountain therapy or whatever, or certain particular types of nature therapy, which is not really a therapeutic approach, but it's a kind of sub branch of holistic medicine.
Il rischio è che poi si scivola nel sincretismo.
There's a risk of sliding into psychological syncretism, where everything is put into a kind of new age approach. This is what happens with new age. I mentioned this. That's Sedona in Sedona in California. Most of the psychotherapy models were appear there because Buddhism, martial arts, everything kind of mixed together there. Now the mental illness, it manifests itself in the person that's expressed. It's important. The qualitative and quantitative aspects are very important. It's like when you go to the physician, and if a person goes to the physician and tells you that you have a headache, the physician asks, with what intensity, with what frequency, and of what duration. If the intensity is low and it lasts a short time, and usually the physician will then say that there's not a problem. In order for a disorder to have to become a problem, it has to have a certain frequency, a certain intensity, and a certain duration. At what level? Certainly, suffering at the psychological level is expressed especially when we speak of especially of emotional problems. It's not a cognitive problem usually. Sometimes we can speak of organic problems or psychosomatic problems, but we speak of emotional problems usually in psychology. This disorder that in the moment in which it has a certain intensity and it develops a certain duration and frequency, since it's expressed on an emotional level, persons who come to us, psychologists, or also to you, or to educators, have emotional problems. They have problems of suffering. Maybe they're looking for meaning in their life, and existential meaning, or disorders that can be structured, anxiety or depression, maybe. They might have, or even real mental illnesses like hallucinatory problems, or also at the organic or body level of their body. The body feels the effects of psychological problems, and so this aspect also must be recognized. And there are this is reasons for suffering, emotional suffering, and the body suffering, which helps people. The person come to us as healthcare, as pastors or educators or healthcare workers because they are ill and they would like to be better. And we have to do work that points toward that is directed to the well-being of these people. Now, in fact, this problem is expressed also at the cognitive level, which means that the person processes their reality in an internal and external way in an incongruous way or an inappropriate way. And therefore, we realize this from the fact that the person behaves in a bizarre way, maybe behaves in a unique way and has reactions that are inappropriate to certain stimuli. Can you hear me? Yes, we can hear you. Yeah. Yes, yeah. Yeah, we can hear you. Yes, we can hear you. Okay. Therefore, it's very important. This thing is very important. This is also a criterion of change. When people are better, it's not only enough to investigate their experience on the emotional or the body level, the level of their body. We need to see if persons have different reactions to as if they behave in a different way or a strange way and an appropriate way. Yesterday, I called that education to responsibility. Otherwise, we do a work that is very more similar to brainwashing. Now, we as pastors or as educators or psychotherapists or psychologists, we have this responsibility to work in all of the aspects. It's true that the person comes to us for a specific problem, but we need to work on the entire person. Otherwise, we will be acting in there will not be good results from our work. Otherwise, we will then reinforce an attitude that unfortunately in recent years is very frequent, to be centered on oneself and to be selfishness. And this is terrible. In fact, people even tend to say that egoism is a value. Obviously, selfishness is an anti-value. This is very important to keep in mind. Okay, I mentioned that the discriminating characteristic for the manifestation of disorder, I would qualify them as a problem. These are the parameters, the quantitative parameters. That is, if a person has behaviors that are inappropriate, but they do it in a rare way, so that might fall under, that might be just the characteristics of the person. They may have certain preferences that do not alter, but that if they do not alter their well-being and their social integration, they are acceptable. The problem arises when these aspects go beyond a certain intensive or duration. Then we talk about the qualitative criteria. We spoke about this several times. There is this aspect of incongruence or inappropriateness between a reality and the activating situation and reality. Okay, and then the emotions that a person experiences, the aspect of corporeal resonance, that is how the body reacts to this aspect, and cognitive aspects, and the actions that the person carries out. Now, this is clearly a definition of mental illness that we are using the philosophical and phenomenological language that allows us certainly to recognize the human condition, but to act especially, allows us to act especially. I often say that to my patients, that the important thing is not what what we do inside the study, but what we do after and outside of the studio, out of the office. Sorry, that the important thing is the life of action after our sessions. I tend to paraphrase the sayings of jurists. The words fly and writing remains. The word remains. The written word remains. What counts is what you do. The psychological intervention should be reparatory, and it should prepare you to action. I often pause on. I often find myself with talk a lot about people and their use of words. If they do not represent reality, but they can evoke it, we have to use the appropriate words. I say this to my patients often. There is a tendency to use words in a rather inappropriate way, or by chance, let's say. But this is an important thing because the word cannot represent reality. If you study all the philosophy of language, you realize this because truth. Okay, no, it can evoke it. Okay, you need to use words in a very attentive way, a careful way. Now, this aspect in Aristotle regarding communication really struck me. Communication is never a univocal. It's always equivocal. If we use words that are inappropriate, it becomes even more equivocal, and so it becomes even more difficult to prepare ourselves to action. In the case of mental diseases, we use a classification within the scientific community because of all these models of psychology and psychopathologies that exist regarding communication, that people didn't know what we were talking about. Everyone uses different terms, and if you do that to speak about the same thing, this is a problem in the world of psychology. The excessive use of different types of terms, and to find strategies to try to use a classification that could be accepted by everyone. And therefore, we developed this manual of mental disorders, the DSM, which every once in a while is updated. And now we are up to DSM-5. Okay, so it's a descriptive manual of all of the disorders, mental disorders, so that when we speak at least of a phenomenon, that everyone knows what we're talking about, so that we just have, and then regarding the therapy could be very different, but at least now the problem becomes enormous because if we use different models, there's also a problem of communication between colleagues, between psychologists and psychiatrists themselves. This is very frequent, unfortunately. So I once dealt with a girl who for 5 years did psychotherapy, systemic relational therapy. It was called that. Then we need to take a look at what it meant. It's a form of psychotherapy which is neo-Freudian. It's an approach that is neo-Freudian that derives from Freud, but it's been further developed, and it did not even she didn't even understand what her problem was, and she didn't even change her problem, even less. No, depending on the therapist, she had to discover her true self, her true I. But no, the concept of the I or the self is a Freudian concept and doesn't have anything to do with what this girl needed to do. The problem is that this girl, she didn't understand what that meant. In reality, I didn't even understand from what she explained to me. For 5 years, she didn't understand what she had been doing in therapy sessions. Okay, now the professor, a question here. Excuse me. This DSM-5, first of all, from who redacts it? Isn't there some psycho or world psychologist association that decides on what goes into the DSMs? How much valence does it have? Is it possible to do any research on this DSM? Can you say something? In reality, it is redacted by this community of psychiatrists and psychologists. Evidently, every once in a while they meet through context, with information technology. It's easier to do this, and they update every once in a while. They update the DSM. If you can do research outside of the DSM, yes, certainly, it's enough for you to describe the phenomena that you refer to it and use a language that could be personal language, but clearly it should be as clear and defined a language to describe a new phenomenon. And that's where, in the field of knowledge, we see the appearance of epistemological ruptures. So you furnish a different way of interpreting the same phenomenon. Clearly, it must be clear. They must be clear. This definition must be clear, should be clear, but it can be done. It can be done, certainly. But isn't there a problem that appears here? How can I do research on a therapy that I could not do until I go outside of the...
No.
Let's say the case of homosexuality, when they removed homosexuality from the DSM. If I'm trying to help a patient to reappropriate their biological identity, blah, blah, blah. I'm not going to enter too much into detail. If the DSM tells me that, no, you can do research. I think there are certain, I know many psychiatrists, just of my knowledge, there could be limited to a geographic area. Statistically speaking, you cannot generalize. They do not give a great reliability to do ESM because of medical legal aspects. You can move within a different approach, certainly, by proposing theories that are founded at the scientific level in some way. Then being kicked out of the list of psychologists, because to be kicked out of the list of psychiatrists, you have to do really terrible things. It's very difficult to be removed from that. He's talking about the priest is talking about it's very rare to be kicked out of the Association of Psychologists and Psychiatrists. Excuse me, Professor, what Father is saying, Father Samuel is saying, is true, and because it's happened in Spain recently, that there was a current for the fact of in the DSM made a progress regarding homosexuality back in 1973, and they removed that as a disease. And now today it's practically a behavior, and that's it, and not an illness. There's a big group that used the therapy of let's say, I don't remember what it's called, reparative therapy, to consistent that the person would refine themselves again, and that they could reach their biological sex. And the problem in the gender and transgender ideology, that the person might be able to reconcile themselves with their biological sex, we could say. Now, they were threatened with to exclude them from the Association of Psychologists and Psychiatrists, and so that they could not exercise that therapy. For example, in Spain, the case, psychologist, I think there's a female psychologist, Enerago, that's her name. She was practically kicked out. She was excluded. She was kicked out because she was part of the school, which is also an American school also. Or for that reason, that's why the father is speaking about this. That's what the father is talking about. Now, these aspects clearly, I did not know. I do not share that. I do not share that, rather. The possibility to express any opinion, and opinions will be confronted with the foundations that, no, certainly this depends on the norms or the legislative norms that characterize different states. I believe that it's important to also do research outside of certain parameters that could be accepted at the international level. The conclusions of these research can bring results that are different sometimes, and sometimes revolutionary. Why not? Otherwise, there will never be. If you study the history of scientific progress, you'll see that progress has never, and step by step, it's never been an increase that is progressive, let's say. But we have to have epistemological ruptures. There is one person who proposes a completely different approach, but lobbies, unfortunately, is a political fact. It's a social political fact. They enter and they determine, but they determine what goes into the DSM in Italy. Yes, in Italy. Okay, consider that in all the world, psychology has existed from the end of the 19th century, even at the world, especially in North America and also in Europe. It's only been around for about 130 years, 140 years. Now, the first law that recognized the profession of psychologist, it has a social value. It tends to regulate a profession for the good of the community. Now, the regulation, the proposal of a psychological list has began in 68. It was approved in 1989. In 1980, for what reason? Because of a problem of contrast of lobbies of physicians, basically. There were it's not a personal thing. There were physicians among. There were a lot of physicians that wanted to keep psychologists and psychiatrists from being considered doctors. Okay.
Questo per dire che c'era un ritardo legislativo, quindi nell'89.
Only in 1989 were psychologists considered actual professional figures, and then there was on the legislative level in Italy, while in other countries it was about 100 years before that. The first degree in psychology, there was a degree in sociology in 1970, and in the 1970s. That was the first time there was under the pressure of the revolutionary movements of the 1968. The first degree in psychology in Italy appears in 1972. There was no faculty of psychology before 1972 in Italy, not officially speaking. So we had a great delay in the use of psychology in Italy. 90% of those of psychologists that are professional figures are free professional workers. Why? Because there was no institutional space. I am able to work for the state, not because it's a work that embraces a very wide sphere. Let's say 90% are become because there are no institutional spaces for us. Many of it. Often they do not work in hospitals or even in institutions where psychologists are. They don't work in collaboration with other psychologists very often because of the fact of culture. It's a cultural attitude that many of them have, which clearly expresses and reinforces, and it is influenced by the legal aspects, certainly. That's true. I still meet people, and I'm not speaking about common people. That I can understand, but physicians I know, and even psychiatrists and neurologists who tell me that psychology is not really a science in the end. No, I have a degree in systematic philosophy. That is the philosophy of science in the Gregorian University to understand if psychology really was or not science. I spent 5 years trying to figure that out. I insist a lot on that. No, certainly there are certain adventures. No one calls into doubt a physician is a scientist and has this authority. There
diciamo, bizzarri, c'è gente che fa delle cose in giro veramente, diciamo, folli. C'è un libro.
There's a book in Italian of Erickson. If you're interested, you can buy it. It's interesting to understand the Babylon that we see in regarding the models of psychology, which is called crazy psychologists. That is people who do crazy things that similar to the tree hugger therapy.
L'effetto terapeutico a livello cardiovascolare, endorfinico, eccetera, ma non la proporrei mai come una psicoterapia.
I would never propose that as a psychotherapy, exactly. Even the use of animals can be helpful. It can be added, but it is not because you use animals that it could be called pet therapy or mountain therapy, et cetera, et cetera. Unfortunately, yes, there's a delay from this point of view and from the cultural point of view, which is expressed at the legal level. And the legislatures, in fact, express this delay. In Italy, for example, we I suffered this a lot. The institutions are not open to the figure of psychologists. I know departments of mental illnesses, which are called SPDCs, where psychiatrists manage the psychiatric wards. Sorry. And there are no psychologists. There are no psychologists. It's true that certain psychiatrists are not also psychologists, but the figure itself is not considered. It's a cultural fact. So therefore, we need to work against this aspect. You could say, okay, at this point, I can just be a psychiatrist. It's not so, that takes 10 years to do, but you might want to do something else. In all the world, it's recognized. It's only in our country that it is not recognized as much. Now soon we'll have a 5-minute break. Now, when we speak about, is it 9:15? Okay, we'll stop now. Gennaro will criticize me and not let you. Okay, we'll meet again in 5 minutes. Is that okay? Okay. Are you using the slides? Because we always just see one slide. Okay, which one is your slide? Criteria of the theoretical model. Yeah, it's that one. Yeah. Yeah, it's saying it's strange to me. Exactly. Yeah. You see it? No, è sempre lo stesso. Ok. No. Adesso sì. Adesso sì.
La vedete? La malattia
You see
mentale.
it?
Adesso sì.
Yes, now it can. Okay. No. Okay. Okay, we'll meet at 9:21. Then we'll finish. Instead of at 10, we'll stop at 10:05, maybe. Okay, we'll meet again soon. We'll meet shortly at 9:21.
Il criterio qualitativo.
Sì,
criterio qualitativo. E l'ultima parola lì che dice la situazione attivante.
Ok. Allora,
per favore, sì.
Che cosa si intende per situazione attivante?
Sì.
Situazione attivante si intende la realtà. Cioè, per esserci un'incongruenza fra la persona e la realtà. Quindi, chiaramente io ho usato un termine tecnico, però l'avevo detto, ma evidentemente sono stato troppo rapido nel dirlo. Per situazione attivante si intende...
By activating situation, we mean the reality that's outside of the person that activates their problem, their historical, social, or geographic reality. Okay, that activates, that triggers, let's say, the illness. Can you give me a concrete example, please? Okay, let's say it will be more clear when I explain my models. A delirium, no? I don't understand. A delirium? Would it be that? Delirium would be a behavior. Okay. You can see in the slides, it would be a behavior, an inappropriate, a behavior that's inappropriate to the situation. There are certain behaviors that seem from the outside to be delirious and that are inappropriate in certain situations. They are not congruent with the reality, right? Precisely because they are not congruent. They have a certain duration, frequency, and intensity that we can speak of a disorder, which in reality takes the form of a problem. Clearly, this is a definition, phenomenological definition, but it tries to frame
l'identificazione di un problema, altrimenti
the identification of problem. Otherwise, you don't understand what the problem, what is a problem, what is not. This is may seem an obvious thing, but in psychology, we need to use. It seems we need to define what contents and the concept of science, etc. We have to make explicit what might seem obvious, but isn't always. Okay, now these aspects.
Io capisco che per chi non ha una formazione in ambito psicologico possa sembrare ovviamente non chiarissimo alcuni aspetti, però quando si parla di aspetti incongruenti, inappropriati, si intende ad esempio il fatto che la psichiatra utilizzasse gli alberi, l'abbraccio degli alberi per aiutare le persone. Cioè, è un comportamento inappropriato perché non è stato dimostrato che ci sia un benessere effettivo. Poi anche se ci fosse un benessere, perché la persona appunto, la persona paziente esprime questo fatto di vivere bene questa esperienza, il problema è che
Now the problem is that inside of a community, it might appear bizarre or delirious, which we saw, for example, to the father who
che hanno detto c'è qualcosa che non va.
that say there's something that's not working, that's something that's wrong. Oh, okay, yes. Okay, we're talking. Okay. Okay, he's talking now about the example of. Okay, I insist on science. On the, it permits us to act to have a filter against the craziest currents that we might see in certain models of psychotherapy. We need a minimum of filter. Otherwise, we would reach 500 or 2,000, and everyone would just invent their own theory in psychology. It would be scientific anarchy.
Dell'anarchismo metodologico e anche dei contenuti. Però vi sarà un po' più chiaro quando parleremo dei modelli. Tanto adesso parleremo dei modelli.
Now we're going to talk about the various models now. As far as the etiological aspect, what are the causes of these disorders? Now, we are incarnated spirits. We are psychosomatic unities, so necessarily I have either there's a psychological or there's either an origin in the body or in the mind or the spirit. Okay.
Primo livello, diciamo. Collaboro molto con psichiatri e
I work a lot with neurologists and psychiatrists, and especially psychiatrists, especially because when certain problems are involved, like in the case of psychosis. There could be a biochemical disorder, and then we need to do a psychological re-education so that the person can learn to accept this condition that they have, this pathological condition, which is not easy to accept that they have a mental illness, and then that they be reinserted into the social community. It's difficult, but it can be done. And then sometimes there are disorders which have a psychological origin, which could be depressive disorders or existential problems. These are not psychological problems, but they can have psychological effects. When we speak about education responsibility, this is an aspect that goes beyond the mandate of the psychotherapy. Psychotherapy should have a function, a clinical function. But since we do not only work on problems, but we work on persons, at a certain point, this aspect comes out. The aspect of the request of meaning and the aspect of what is good and evil comes out. And the aspect of what I know that exists in me or exists in itself. Does it exist in me only, or does it exist in itself? The problem of knowledge and the ethical problem and the problem of meaning, existential meaning. That is, we cannot say, we cannot not deal with this. We need to deal with this, and you need to deal with this because, in fact, and educators even more, because in fact, we work with people, and we can. A cardiologist could do it. He could say to the person, if you continue with this lifestyle, your disease will worsen, and then just stop there, and that's it. Because he deals with a certain aspect, just the heart. We deal with persons, though, and that we can identify the problem, but we always need to be oriented to persons, always. This does not take away the fact that we can't refer also to, we cannot refer also to biochemical aspects. They need to be recognized. There are great experts in the field of psychiatric biochemistry. I work with people who are very well trained and who are very welcoming and accepting of people and have a great empathic and relational capacity. They are not psychotherapists, or rather they are, what they do is called observational psychology, but they have a great capacity, a human capacity of accepting people. This is important. It's not enough, but we can love each other, but that's the first aspect. But sometimes we also need to structure it in an action that can be an action of help. Otherwise, it just becomes a clear, just it remains at the level of good intentions. Now, we spoke a lot about these different models. Now let us enter into these models. I present 5 of them here. There are 10 that are used that are the biggest ones, but these are 5 in the whole of the world. These are the most representative of the 500. 80% in the world use the cognitivistic model now, which is number 4.4. That I used to use the classical cognitivistic method. I'm not going to talk so much about the classical method or versus the very. In Europe, there are a lot of different schools of cognitivist models, but 80% of the psychotherapists in the world use the cognitivist model for 2 reasons that I mentioned earlier. The first reason is that it works. Clearly, as us as worker, we try to use all things that work, right? But it's not enough in order to avoid psychotherapeutic anarchy. It's the only model. It's not the only one. There's also the behavioral model, but it's one of the few models that appears that from research, that comes out of research, structured research, academic research. Unfortunately, quote unquote, only from the experimental empirical method. When we speak of science, we think of chemistry and physics, but also sociology, which has its own history, and also psychology. They are also sciences. It depends on how they are done. If they are done with social proclamations, it's not science. It would just be ideology. If you remain within certain criteria, you can call it a science. I was saying that 80% psychologists in the world use the cognitivistic model, and 10% use the systemic relational method model. All the others, excuse me, the psychodynamic model would be psychoanalysis. Psychotherapy appears with Freud, and then it develops also with Jung. But let's say that in the last 20 years, it's lost a lot of ground because of reasons of a pragmatic type, a little bit because it did not always work well. It was a model, a long-term model of psychology. 10,000 meetings you have to have, and it's scientific characteristic. It's often being considered not very scientific. A small percentage of therapists still use this model. We need to consider, though, that order to be trained in a model, you need to take 5 years of formation after your degree, at least. So it's not simple to change from one model to another. It's not that you can just say this model, I don't like this model and I want to do another. I have to train in a model for a long time. Now the behavioral model, in fact, is almost not used anymore. It's not used a lot recently because, and we'll see why. We'll speak about the last model. It'll be the last model that we talk about. It's a model that is very scientific, but it cuts out all the most important aspects, emotional experience and aspects of the body and cognitive aspects. Clearly, it cuts the person out. It focuses only on behavior and explicit behavior and action. It has been abandoned because it was very scientific, yes, but in fact, it was an artifice. They studied a phenomenon. It studied a phenomenon which was not human, let's say, in the sense that, yes, the person is characterized by his acts, but not only for that, also his emotional life and his thoughts. The person is something that's very complex, but the behavioral model was very simplified, and now basically it's used for animal training. And why do we? And later on, we'll see why we speak in these terms. And it had the merit of having maintained the attention to the scientific aspect of its proposals, but it no longer has any value on a therapeutic level. Despite this fact, I initially trained in the behavioral method. Since I came from the experimental approach, I was more attracted by a strongly scientific method, but you couldn't treat human beings with this. Now, the humanistic existential model is very interesting. It's developed into 2 different forms now, in the form of logotherapy of Viktor Frankl, whose most important leader in Italy is, and also in Europe, evidently, is Eugenio Fizzotti, who I had the pleasure of getting to know. He's a Salesian priest. He was a direct student of Viktor Frankl, and in the most North American form of Carol Rogers, who is the first one. Viktor Frankl also had the ambition of transcendence, but the one of Carl Rogers is typically of the North American. It has a more pragmatic value. It's a more of an immanent approach, but as we'll see, they propose extremely interesting aspects which can be inserted in a model of psychology. The systemic relational model has taken the inheritance of the
e l'ha inserito in un sistema un po' più ampio.
It's a wider system,
Il 10% del
and 10% of people in the world use that system, the systemic relational model. Now, getting more specific here, the behavioral model. What are the fundamental theoretical principles of it? Can you see the slides? If you do not say the slides, you have them. I sent them in any case, but I want to make sure that you can see them here. Gennaro should have them 2 weeks ago. He said that you had them. As I present them, though, I would like you to be able to see them. Now I'm going to read them and then we'll speak about them. The most important principles are certainly the environment and reinforcement. Environment, then I'll comment on environment as the unique and absolute hermeneutic category for the description and explanation of any human experience. According to the behavioral model, the only modality in order to, let's say, analyze, to describe or explain and foresee, which is part of psychology as its definition, is only the environment. Initially, only the physical environment. The first behavioralists studied dogs and animals and monkeys and mice and pigeons. Then later on, they started to look at human beings. They thought that this idea of evolutionary continuity between man and animals, they slid into a relational and cultural environment. For a behavioralist, the only thing that counts is the environment. So it's a strongly situational component. And how can it be changed? How can the action that, which from the point of view of behavioralist, it has an ontological value. If you speak for them, there exists the action and the thing that it reinforces, or the thing that weakens it. Action and reinforcement and punishment. To reduce the person, they reduce the person to that which they do, and punishment and reinforcement in order to modify it. It seems very reductive, but in reality, this is a model that was used within some psychiatric institutions. It could not work because even a psychiatric patient, despite the fact that we are an object of a delirium, which often has a biochemical origin, they really recognizes human contact because it is not made, but it is not mediated. It is a natural fact. Human contact is an immediate contact, not okay. The aspect of the human aspect cannot be set aside, cannot be overlooked. No. Through the reinforcement and punishment, persons can assume a certain type of behavior through punishment and reinforcement. Now, what are the assumptions? The meta-theoretic points here. What are the meta-theoretical assumptions of behavior therapy, which can be distinguished in their meta-theoretical assumptions, okay, and attitudinal and propensal tendencies can be synthesized in the following formulations. Some look to go back to the physical environment and the relational aspect, and social cultural environments are also involved. Now, yesterday, one of you mentioned to me that they are very deterministic, totally deterministic. For them, everything depends. We're talking about behavioral psychology, whether or not you reinforce or punish a certain type of act or behavior. This is why it's called the behavioral model. Clearly, there are certain specific aspects, negative and positive reinforcement, but beyond technical terms, action is rewarded. If it's punished, the person reduces an action. No. They are very deterministic also as far as their vision. They are reductionist also. Number 3, in the sense that they tend to reduce all aspects in order to maintain this strongly scientific approach. They mean scientific, they mean the empirical experimental approach. In the end, everything is reduced to the biochemical aspect. Everything is reduced to chemistry for them. Not all those who push this model have reached that point. One of the most important people. Okay, many at the end propose to reduce everything to the chemical aspect. Reductivism is to reduce the aspects to the most constitutive aspects of any phenomenon. That is, if I fragment the phenomenon into its constituent activities through a process of analysis, then I can build the whole through the analysis of the parts. This is not true because the whole is more than the summation of the parts. Then evolutionism, the idea that there is an evolutionary continuity between man and animals. Certainly, there are certain common aspects they may have. To speak of the behavior of animals, 90%, 99% of the times it's the product of instinct. The behavior of persons and human being is a product of culture and the environment, usually, and a product of, okay, how can we translate and transport, let's say, the results that have been developed in the experimental environment with mice or pigeons or with dogs, and sometimes even with monkeys, to man. Okay, we are also animals, but we are especially, as Aristotle said, we are social animals, cultural animals, enculturated animals. So this is that way of looking at things is unthinkable. Well, the concept of deviance, this maintained its attention, even though this was not its initial intention. It's focused on the phenomenological aspect. That is to use the aspect of deviance to give a characterization, quantitative and qualitative character to what we said earlier. This is a phenomenological approach. They didn't have that intention, but they had more of a scientific approach. Now, then the a mentalistic attitude. They said the mind exists, but sometimes this aspect, according to the behavioral model, it had an ontological value. That is, not only did they say that it was difficult to study the mind, but they said that really the mind did not really exist. It was just something that we could not speak of. Later on, when speaking with, these are studies from the first years of the 20th century. Some proposed a strongly mentalistic approach. It's also a situational approach. Now, they did not speak of persons. They did not speak of profiles of personality. They did not speak of constants. They spoke of concepts connected to the person in the emotional experience and existential sense and the seeking of responsibility, etc., etc. They were very, very situational. Therefore, if a person behaved in a certain way because they have learned through a social reinforcement to behave in a certain way, whether it's a mouse or a pigeon, maybe because the experimenter had reinforced it with food or whatever. And then it's also a pragmatic attitude. Clearly, for any worker, the pragmatic attitude is very important. But that's not enough. Why? Because we must tend to the pragmatic aspect, but we cannot only deal with this. We cannot only concern ourselves with that. Just a moment, something closed here. Don't know how I can change this. Can you see me? Okay. You can see it now, yes. You can see it, yes, but the problem is different. The problem is that I can't see the slides anymore, the external slides. Okay, we'll cut this out. Also this, okay. Let's take a look here. Okay, let's look at the models again. Okay, here it is, here it is. It came back. Okay, I was saying the behavioral model Okay. Okay, behavioral model has these meta-theoretical principles as far as these principles are concerned. These are assumptions. So it's a deterministic model, and it is a mechanistic model. So this model, its foresight is not, or predictability is not the possibility to identify in the probabilistic field, but it is a provision, a total. Now it is also very reductive model, which is different from which is the opposite of the holistic model. The holistic model concerns the whole person. It is a nominalistic. Okay, it looks. Here that we have common characteristics as human beings, but there are certain aspects that we have that which are very specific and personal. Now, it is also a model that is realistic and that recognizes reality for what it is. Right now, constructivistic models are also very fashionable these days among psychologists, where we understand reality from the not from the from the semantic point of view, which is where reality is a construction of the individual. Then the reductionist model, which tries to analyze, and then from that we slide into from psychology to biology and then to chemistry. And it is a model that's empirical and experimental model because it opposes itself to the historical phenomenological model, which is typical of the human sciences. Now let's speak of the psychodynamic model. You see the psychodynamic model is completely different. Now I'll present it to you. You'll see how almost it's unthinkable that the spokesman of a behavioral model, technically called behavioralist, and the spokesman of a psychodynamic model could even understand each other. They couldn't even communicate with each other, and I'll show you now why. Let's speak about these aspects. It's rather evident, but it's not that they use language that's slightly different. They have a hermeneutic and anthropological method that are completely different from each other. They are two persons that speak completely different languages. Or there is a total incommunicability. Consider that at the beginning of the 20th century, in all the world, there existed only two models, the behavioral model and the psychodynamic model. Evidently, the psychodynamic model in Europe and the behavioral model in North America. But obviously, there was also a influence of a cultural and historical type. And for this reason, clearly, the behavioral model appeared in North America and the psychodynamic model appeared in Europe. And then for historical reasons, North America also was influenced by psychodynamic model, but then there were modifications of the various models that brought us to the cognitive and behavioral model and the cognitive model to the systemic relational model. And clearly then there also was the emergence of to understand where the person ended up, this emphasis, the scientific emphasis in that thrust, the person was forgotten. Now, what are the fundamental theoretical principles of the psychodynamic model? The unconscious. They speak a lot about the unconscious, a lot. Because in the field of the psychodynamic approach, it was a fundamental aspect. It is a hermeneutic category that's fundamental. Just like the behavioral model was the environment, for the psychodynamic model followers, it's the unconscious. The unconscious is that which is not aware, that we are not aware of. Therefore, the unconscious as a hermeneutic category is a psychobiological and structural functional component which is fundamental to the personality of the individual. Therefore, according to the psychodynamic approach, we are only, not also, but we are only the fruit of our unconscious, our unconscious. For behaviorals, it was only the environment that creates us. We are for the psychoanalysis, only the unconscious. In fact, Freud absolutely did not give any importance to the aspect of awareness, because all he had, and he says that the person is completely dominated. The entire person is completely dominated. He presented the most negative aspects of the unconscious, and then Jung proposed also a positive aspect of the unconscious. Everything was characterized by aspects which were produced and which could be emotional issues and also thoughts. And that is, they were only the fruit of the unconscious. That there is no mastery. People have no control over their lives. Our lives are the fruit of an unconscious which is not directly controllable by me. Clearly, it was identified in its various structures and levels that form this unconscious. You can call it S and the ego and the super ego, the super ego, the ego and the id, etc., etc. For example, that patient that had a therapist that spent 5 years trying to help her to get in contact with her true ego or her true self, and she didn't even know what that was. The responsibility we see here of the therapist of the relationship of the therapist and the educator, certainly. They come to us because they are looking for help. So we need to be the ones that are able to communicate with them and help them in the form that's more congenial for them. So they understand us when we're talking to them. And then for 5 years are a lot of time. Yeah, that's a lot of weeks. 5 years. No, there could also be therapies that can just last for 1, 2, or 3 years. But after 2 years, 1 year, you need to be able to see that the person improves. But this person was not well. Not only that, otherwise they wouldn't have come to me. But they suffered from anxiety and problems of existential problem. But they didn't even understand what their problem was. They said, "What is your problem? What did your therapist call your problem?" And they said, "Never. What name did he give it to it? It was a name and a reduction of a reality. But you have to at least have a name as some indication or an evocation or something." But she said, "Oh, I don't know. I only know that I have to have contact with my true self." I said, "Did she explain to you how?" And no. So in that case, we'd really be for 5 years. After 5 years, okay. I do not presume that a therapist be scientific like a chemist or like a physicist or even like a doctor, a physician, but you cannot. It's not that if I take out a theory, pull out a theory only because I believe in it strongly, and that this theory becomes true. This correspondence between thought, language, and reality in the conception. This is an Aristotelian concept. It's not that this explains the civi therapy. What sense does this thing have? It could also be that these psychiatrists felt better when they hugged trees, but they saw that the patient was okay. Not only this patient that I'm talking about after 5 years, not only didn't understand their situation, but they didn't have a map of any type. They didn't know where they were coming from or where they were going. The model is often a map. So that at least corresponds to a territory, but this particular patient didn't even have the map. If we have to navigate in the high seas, we need to have at least a map. The map must reflect where we are going and the reality that we're living in. Sometimes the behavioral model is a map that does not correspond to a reality. It's like we are not the fruit of our unconscious. If that were true, we would not have any responsibility. We would not have any responsibility for anything we do. We would remove what someone yesterday made emerge, which is the idea of liberty. It's a strongly deterministic approach, which is similar to the behavioral model, which is very, very deterministic. Excuse me, approach. This psychodynamic approach, can it be used together with a phenomenological approach in the sense of discovering the unconscious in order to open reality, my reality, and to go forward and find a meaning? Yes, yes, this can be done. This can be done because it's clear that we'll see, for example, that with the cognitive model, it proposes the category, the hermeneutic category as a structural and functional structure. It's the category of awareness is very fundamental. Okay, we are also the fruit of unconscious aspects. Certainly we, not the unconscious that Freud identified, but we are also also influenced by aspects of our unconscious. Our spontaneity is the result of our history also, but we also have a capacity of direct determining, which is reduced, but but awareness does exist to be able to act in a different way or to think in a different way. We are the fruit of our history. That is true. Freud was genius in this. He was the first one to propose that. Okay. He translated it from philosophy, that's true, but he inserted it in the framework in which he spoke in his times of biomedical aspects. What I wanted to say, Professor, if you allow me, that you said that sometimes these patients are called crazy people in the common language. They often need something that is human, right? Yes, absolutely. Yes, I remember that the chapel of the hospital was right next to a psychiatrist, so they came to mass very often. Once I was celebrating mass, and I opened one of and one of them looked at me with a look that they looked at and they went to me and they looked at me with this terrible. But I continued to say the mass, but with terrible fear because I was really scared because of the face that they gave me. But when they came to me, close to me, and I'm saying, I said, I thought that because they had a face that was out of this world, they said to me, "Can you give me a hug?" And so I gave him a hug, and he was very happy, and he went away. That's all. Then I understood there that sometimes we are afraid. Maybe it's our things, our limits, I don't know. But he needed only that. That's all he needed. He did not want to harm me. Absolutely, yes. I tell you as a clinician, not as a theoretician. Okay. Mine is not just that my idea is a theoretical idea of what should be done. I experienced it every day in therapy and also outside of therapy. Consider that I come from a behavioral approach and then a cognitive approach. Then in practice, I realized that as a technician, I could help, but especially the acceptance and relationship with others, that I could help people better. Okay, absolutely. Like yesterday, I was saying to them, more than hugging trees, people need to hug people. Okay. If we had been taught that hugs can attenuate or at least create the conditions to be able to work and to be able to enter many things within the situation, no relative would have said anything because they would have understood that it was maybe an approach that was not so accepting, but at least it would be acceptable. For example, beyond the models, there are certain aspects that characterize the ontological aspect of any therapist in the world. It's very rare that a therapist would have a friendly or approach to the patient or too friendly. But this aspect is very important, because if you become and necessarily in confidence, you need to no. There's always this risk, this attitude of distancy and dynamic. Okay, it's if you are too distant from the patient will perceive rejection. Otherwise, but the opposite can also cause the patient to perceive excessive invasiveness. Now, during COVID pandemic, in various times, I called patients, and which I never used to do on the phone, because it's a practice that's rarely used, but it's more the patients that call us normally. I called them because patients were at home and patients that were in hospitals, because I understood that they needed, let's say, some comfort. In fact, they experienced the pandemic very well, because in fact, it's a fundamental aspect for them. This fact of hugging doesn't amaze me. No, and the fact of avoiding it, in the sense that I'm very welcoming and effective. Yes, but hugging, especially I as a man towards a woman, I would help her, but I'm very, very, very welcoming and very available. And persons call me on the Sunday but I have to say I'm also sober, but in the university they called me on Sunday. But the fact of hugging is very important. Or welcoming, acceptance of people, which is expressed with it can be expressed in other ways though as well. Yes, absolutely, yes. Here we're talking about a psychiatric patient. Yes, yes. And regarding the phenomenological aspect, we can supplement it with the idea that there exists an unconscious level that can guide us. Absolutely, yes. There is an unconscious that can guide us. Yes, it's not the one of Freud, in part the one of Jung, but let's say that the concept of the unconscious, which is called the Freudian model, but in reality, it can be thought of in now. The first point is for Freud, and clearly for all of those who followed Freud, is the concept that explained any phenomenon, any pathological phenomenon, was the concept of psychological conflict in the unconscious. Now, according to Freud, psycho-unconscious conflict was the absolute determining factor, very often at least, often, absolutely, of the problems, psychological problems of the individual and reality of every. So if a person had a certain type of behavior, a certain emotion of suffering, it's because they had a psychic, unconscious conflict that was unresolved. This, for example, is an affirmation that was never verified, though. If you have a phobia against cats, according to behavioralists, it's because you learn to associate cats with something negative. According to psychoanalysts, it's because there's a conflict, an unconscious psychological conflict that's unresolved that concerns a symbolic aspect that's connected to the cat. They talk about symbolic aspects a lot. As professor, I tell you, in the case of this psychiatrist in Argentina who had that school, for example, I saw that the symbols, in the case of the cat, for example, the person sees the problem unconsciously, but she, through her imagination, does it. It makes it become conscious of this. Yes, yes. And then the person ended up resolving this problem. No, problem is not to use the concept of, to not use the conscious of reinforcement or unconscious. Okay, hugging is social reinforcement. The unconscious exists. Freud didn't invent it, but he transposed, he used it in a framework that didn't used to be used, which is in the context of psychology. It's the problem is not to use or to use the symbolic aspect. The problem is how it's used, usually in the field. Okay, it's very fine. The problem is that if you do not think that there is a determining factor between one phenomenon and another, this affirmation, it was never confirmed in any place. This was an idea of Freud. And Freud says also had very good ideas and optimal ideas from this point of view, but it was little scientific, because it's not that because a person thinks something that the thing becomes real. And therefore, this aspect of the scientific aspect was little taken into consideration. It was taken as true just because Freud said it, because he said it, and Freud was a genius, and therefore it was true. Okay, what is the modality, the queen modality, in order to investigate the unconscious? It's with dreams. Okay, let's say this story of a psychoanalyst who wrote down the dreams of the patient, because the dreams, since in dreams, the various types, let's say the aware ones, where you cannot act, let's say, and then the types where there's this freedom that's connected to dreams. What comes out in dream was the real personality of the individual. That's what they thought. And so through dream analysis, they try to understand the unconscious contents and what they are. Okay, clearly this is another aspect that concerns whether or not the problem is due to a unresolved psychic conflict, because clearly psychoanalysis, at least the Freudian one, proposed a psychological development of the individual through making fixed, that is, if the person is changeable by the experience. Therefore, if the person had problems of psychological problems, and it's because they didn't remain, they were fixed and blocked and stuck in this evolutionary development, that level of evolutionary development. Okay, now it's 10:15. At 10:15, I'll finish. Now, what is being? And we'll pick this up tomorrow. Being, according to Freud, is the biological component of personality and the original distance of the person from birth, and the primary source of instinct and energy, and it governs the principle of pleasure, and it is illogical, amoral, and unconscious. This is an hypothesis that Freud proposed in order to explain the unconscious world. The seeking modern research and today's research has demonstrated this aspect that no, has it? No. Some things that he said were true, are true. Others. No, it's 10:15. Now we'll stop here and we'll have a 15-minute break for the next teacher that comes along. Okay. Okay. He'll come at 10:30. Okay. Tomorrow we'll be, no, sorry, tomorrow at 10:30 we will meet up until 1. Okay. We'll have a couple of breaks to break things up a little bit. Okay. Very good. Okay. We'll meet and we'll meet again tomorrow. Okay. Thank you very much. Thank you.